And good afternoon, I'm Andrea Lutz. We are waiting on Yellowstone County Health Officer John Felton, who's going to be providing an overview of impacts of COVID-19 that are happening right now in Yellowstone County. So let's go live to Riverstone Health.
We did not see a post-holiday surge in new cases like many areas of the nation did. Further good news is that our daily average of new cases dropped below 25 per 100,000 population for the first time since September. Infectious disease experts within our Unified Health Command, including physicians and nurses representing Billings Clinic, St. Vincent Healthcare, and Riverstone Health, concur with national experts who have determined that 25 cases per 100,000 population is a threshold indicating that dangerously high levels of spread are occurring in the community. The number of COVID-19 cases in children and teens under 18 continues to be about 14% of the county every month since the academic year began in August. The hard work and dedication of teachers, administrators, parents, and students has allowed our schools across Yellowstone County to remain safe and open. There's good news on the number of hospitalizations too. At the peak of our most recent surge in November, over 150 people were hospitalized in Billings for COVID-19. During the last full week of December, Billings Clinic and St. Vincent Healthcare still had more than 90 patients hospitalized with COVID-19. In the last week of January, they had less than half that number daily. Under 40 COVID-19 hospital patients were hospitalized. Today, our hospitals have 30 COVID-19 inpatients. I now want to take a bit of time to explain further some increases in Yellowstone County COVID-19 case counts and deaths. The last week of January, you likely noticed an increase in cases. There were 209 positive COVID-19 cases added because of delays in public health receiving positive test results from a private lab. Some of these dated back as far as October 2020. In addition to Riverstone Health receiving the delayed results, the Montana Department of Public Health and Human Services also did not receive the results until the end of January. The number of positive tests actually conducted in the last week of January continued the decreasing trend we saw in December and earlier in January. Not including the 209 old cases, Yellowstone County had 1,423 new cases in January. That is slightly more than half the new cases we saw in December, 2,722, and 1/3 of the 4,204 positive cases reported in November in Yellowstone County. Also at the end of January, the Montana Department of Public Health and Human Services completed a reconciliation of death certificates, and Riverstone Health was notified of 47 Yellowstone County residents who died of COVID-19 related illness between September 3, 2020 and January 13 of this year. Most of these deaths occurred in November and December in private homes and senior care centers. Throughout this pandemic, there's been a misperception that healthcare providers and public health agencies have some sort of financial interest in determining that deaths are related to COVID-19. Nothing could be further from the truth. The only time that deaths are considered related to COVID-19 is when the physician completing the death certificate documents that COVID-19 was the cause of or a contributing factor to the person's death. In addition to the more than 450,000 Americans who have lost their lives in the pandemic, the passing of so many community members deepens our community's loss. At least 228 Yellowstone County residents have died from COVID-19 related illness in just 11 months since our first case in March of 2020. Even as we mourn those we've lost through the pandemic, we're seeing positive trends in the weekly Yellowstone County COVID-19 dashboard. Last week, we no longer had any indicators in the red or the danger zone. The dashboard data indicate yellow or caution status for the number of active cases in our region, the daily new cases in Yellowstone County per 100,000 population, and the rate of positive tests. We are at green or normal operating capacity for public health case investigations and contact tracing with no backlog. Yellowstone County is also at the green level for the capacity of our testing and our healthcare systems. Let's talk a little bit about our enforcement and education efforts. Yellowstone County's team of COVID-19 education liaison continued to follow up on public complaints and conducting spot checks of compliance with the state's emergency public health requirements. In January, the team checked out 93 complaints and confirmed 30 violations. Most complaints were received in the first 2 weeks of the month. When violations were confirmed, the team provided information to the violators on how to come into compliance with public health protocols. The team also conducted 474 spot checks of businesses and observed 50 violations of the governor's mask mandate in January. The number of mask violations observed increased from the first week of January to the last week. The spot checks show a significant portion of businesses and customers are following the mask protocol. It is concerning, though, that the trend is toward more mask violations. With fewer people wearing masks, this critical preventive measure is less effective at slowing the virus spread and puts more people at risk of getting sick. Let's talk about vaccinations. Since the COVID-19 vaccines became available under 2 emergency use authorizations, demand for vaccinations has substantially outpaced the supply available in our state and our community. I'm grateful that Walgreens and CVS retail pharmacies are continuing their efforts to vaccinate residents and staff in nursing homes and assisted living facilities. Many of these residents and staff have received second doses of the vaccine, ensuring that some of our most vulnerable citizens are far less likely to suffer adverse outcomes should they become infected with the virus that causes COVID-19. In Yellowstone County, we continue vaccinating healthcare workers and first responders. Just a few weeks ago, Riverstone Health and our Billings Hospital partners started offering vaccines as supplies became available to community members who are in the 1B priority group established by the governor and the state health department. This group includes people aged 70 and older, people aged 16 to 69 with certain defined healthcare conditions that put them at high risk, and Native Americans and other persons of color. We're committed to ensuring that everyone in our community who wants a COVID-19 vaccine receives one. To that end, Riverstone Health is joining with St. Vincent Healthcare in planning a larger free community vaccination clinic for healthcare workers or first responders who have yet to be vaccinated and community members who meet the 1B priority group criteria. We're tentatively planning to hold a vaccination clinic next week at Metro Park. Details on how to make appointments will be released later this week. We don't yet know how many doses of vaccine will be available for the clinic, but both federal and state leaders are working to increase vaccine supplies going into communities. Billings Clinic will continue to offer vaccines to our community on its campus, so there will be 2 sites in Yellowstone County providing this critically important service next week. We know it has been challenging, and many people are frustrated with their inability to make an appointment to get a COVID-19 vaccination. Most of the calls to our public health line are about vaccine availability. We're working to vaccinate everyone who wants a COVID-19 vaccination and anticipate that as more vaccine manufacturers apply for and receive emergency use authorization from the Food and Drug Administration, vaccine supply will become more plentiful. While we await greater supplies and eventually more vaccination providers, all of us must continue to take precautions against spreading the virus. We're all tired of wearing masks, keeping our distance, avoiding large gatherings, and working or studying from home. The virus, though, is still in our communities and spreading, so we need to mask, distance, sanitize, wash our hands often, and stay home when we're sick. Doing all of these things will help keep us, our families, our coworkers, and neighbors safe and allow us to return to normal activities sooner. The new variants of the virus that could spread more quickly are adding yet another challenge to our pandemic response. We've learned a lot about COVID-19 in the last 11 months, and we're still learning about the variants. What we do know is that there's not a definitive treatment for COVID-19, either in its original form or any of the identified viral variants. So prevention remains our most effective intervention. It's even more important that we all do all that we can, getting vaccinated when it's your turn and continuing the public health prevention measures we all know so well to help prevent the variants from becoming more prevalent and prolonging the pandemic. I'm thankful that most Yellowstone County residents, including most of our local businesses, are still taking the pandemic very seriously. But we continue to hear from people who say that COVID-19 is no worse than the flu. I want to share some factual information comparing influenza and COVID-19 in Yellowstone County. So far in the 2020-2021 flu season, the entire state of Montana has yet to record even one lab-confirmed case of influenza. Typically, Yellowstone County flu cases peak in the month of February. In the previous 5 full flu seasons, Yellowstone County recorded a total of 5,502 cases of flu that resulted in 23 deaths. 23 deaths in a 5-year period, or an average about 5 deaths per year. Since March 2020, 11 months ago, Yellowstone County has confirmed 15,768 cases of COVID-19 in our residents, nearly 3 times the total number of confirmed cases of flu in the entire 5-year period, and 228 deaths. 228 of our friends, neighbors, and coworkers have died of this new viral illness, nearly 10 times the number of influenza-related deaths we've experienced over a 5-year period in less than 1 year. COVID-19 is simply more prevalent, more virulent, and more deadly than influenza. In closing, we are still in the midst of the COVID-19 pandemic. While the month of January trended in a positive direction for the second consecutive month, many epidemiologists are sounding a warning alarm that the new variants of the virus and relaxing of our individual and collective vigilance in following the prevention measures could set us back to the dark days of November. The future is in our hands, and I encourage each of you to do all you can to help bring an end to the pandemic. Thank you again for coming today, and I'll now answer questions from the media.
Mr. Felton, my name is Ed O'Brien. I work with Montana Public Radio in Missoula. Thank you for this opportunity. Lawmakers have sent a COVID liability protection bill to the governor's desk. It's one measure he says needs to be in place to lift the statewide mask mandate. I think you've answered this. I'm going to ask anyway. Thinking of current cases and level of vaccine prevalence, is Yellowstone County ready to relax your old mask mandate?
So Yellowstone County does not have a county-based mandate. We've always followed the state's masking mandate. What I think is clear is even as the restrictions become relaxed, it's still important that we all do our part to prevent the spread of disease, which does include masking when we're around other people and distancing and sanitizing and those sorts of efforts. So we will continue to follow the governor's directive when it comes to the mask, but again, encourage people to make their own decisions to mask regularly.
Thank you.
So last week the governor redirected almost 20,000 vaccine doses. Do we know how many of those would be going to Yellowstone County?
Yeah, we have. We sent out a press release earlier. I don't recall the numbers right off the top of my head, but we do have more doses coming in this week as a result of that. Yeah.
Ed, again, how's testing going? Is enough happening to confidently know how much disease there is in your county? What are some of the biggest challenges, et cetera?
Yeah, so we continue to not have any limitations on testing at the Riverstone Health community testing site. We're testing people who are symptomatic or asymptomatic. Certainly the volume of requested tests has come down as the prevalence of disease in the community has come down. Our test positivity rate has been under 10% for I think 5 of the last 6 weeks, and we haven't gotten last week's data yet from the state, but that would indicate that we are doing a sufficient degree of testing and that the prevalence is coming down as we've seen.
Hey, John, this is Mari with the Billings Gazette. I know you said that more details on this mass vaccination clinic will come out later this week, but are there any other details you can provide us at all in terms of how it'll work or how people sort of, if they have to register or anything like that?
Yeah, Mari, the vaccination will still be by appointment because all the same issues are in place in terms of needing to limit the number of people in the space and provide for the monitoring period after the vaccination. We have vaccination planning teams that are putting the final touches on exactly how that scheduling will happen. And of course, at this point, we don't know how many doses we're going to be working with next week. So it'll work in many ways similar to what we're doing now in terms of it must be by appointment. There'll be no sort of walk-in capability. But the details on exactly how registration will happen aren't available yet.
Is it sort of mashing together the, I guess, the shipments that St. V and you guys get, or Riverstone?
Yes.
And using those together for a clinic, or?
Right. So for this initial step, we're going to combine the doses for Riverstone Health and St. Vincent, and we'll jointly staff that clinic. Billings Clinic continues to offer its community-based vaccinations on their campus. So essentially, we're going from right now 3 sites of vaccination to 2.
Okay, thank you.
Any other questions?
I guess about, it's kind of maybe too soon to tell, but have you seen any problems with weather and right now 1B is a lot of elderly people who may not be able to get out to their appointments and make it to get vaccinated? What are their options?
Yeah, we really haven't seen that yet because, of course, it just came in over the weekend, and we're just now scheduling this week's vaccination clinics. I'll tell you that throughout since vaccines have been available, the demand has been extremely high, and I anticipate that will continue. It is certainly a challenge for some people, and what we're trying to work towards is more accessible vaccination sites, and we think that our shared site with St. Vincent might allow us to have a little more space to work with in that regard.
Are you still seeing the volume of calls that you were seeing when we went into phase 1B, and what advice would you or what would you say to people who are still waiting to get vaccinated in phase 1B that have called a lot to try to request an appointment?
Yeah, that is still the number one source of calls that's hitting our public health information line. You know, I think we just need to continue to get vaccine out as quickly as we get it. I know that our friends at the state and at the federal level are working very hard to increase that supply. Really, all we can really ask people to do at this point is just be as patient as they can. And remember that until such time as we reach a high level of vaccination in our community, we need to continue with the preventive measures because the disease, even at a lower level, is still circulating in the community. There's no doubt that we still have disease circulating. So I know patience is hard, but that's really the best we can do right now until we get a greater supply of vaccine.
Hey, John, I had another question. This is Mari again. Just talking about the violations, the business violations and education liaisons. Have any of those gone to like the attorney's office or anything like that? Or have these cases sort of been resolved through education and that sort of thing?
So all of the results of our visits are shared with the county attorney's office. And we work closely with them, so they're aware of all of this, all of the complaints. The county attorney is aware of all the complaints, is aware of what happens when our education liaisons go out. So none of that has changed in terms of process.
Okay. Yeah, I wasn't sure if there were any other, if any other action has been, I guess, taken against any businesses in Yellowstone County at all.
So as public health, we don't have the authority to take that sort of action, and you would need to check with the county attorney's office to determine anything that they have done with respect to those types of complaints and responses.
Okay. The other question I had too, and maybe I misheard you, but just in terms of variants, we have not detected any of those variants here in Yellowstone County at all. Is that right?
Yeah, at this point, you know, not every case is certainly being tested to see if there's a variant involved. I think the general feeling and belief is that it's not a matter of if, but when variants arrive. The keys are this. There's still no definitive treatment for any case. And so the best thing we can do is prevention. And the prevention measures are exactly the same for the variants as they are for the original form of the virus. So from a practical intervention perspective, nothing changes until there's actually a definitive treatment. We need to focus on prevention.
Okay, thank you.
Are you feeling good about the way things are trending? And in that regard, is there going to be, do you know at what point we'll go to 1C? or not?
So I do feel good about the way things are going. What we know, though, about viral illness, and particularly respiratory illness, is it tends to go in waves. So do I think that we're going to go down forever and never go back up? No, I don't think that's going to be the case. I think we will see increases again at some point, just because that's kind of the way these things work. What was the second part of your question again?
At what point do you think you'll be able to go to 1C?
Yeah, that's a decision that is made at the state level. And it's largely driven by having more fully completed the 1B level. At this point, we don't know with precision exactly how many people are in 1B, nor do we know with precision exactly how many are going to choose to be vaccinated. What we do know is that the demand for vaccination and demand for the available slots is way greater than the supply. And I think when we start to see that we're having vacant slots, that would tell us that we've worked our way through 1B. We're definitely not there yet. Any other questions? All right. Thank you all for coming. Please be careful out there. The roads are pretty rough. And as we hopefully we'll continue to see the improvements we've seen, and that next month when we stand here, we can talk about another good month. It's up to all of us to do our part, and I'm happy to say that right now we're doing well, and hopefully we'll continue that. So thank you all.
All right, we were just hearing from John Felton, the Yellowstone County Health Officer. Cautiously optimistic is kind of the feeling that we're getting from him as he talks to us a little bit about the COVID-19 situation that is happening in Yellowstone County. One of the biggest things to come out of this presser is that we're going to have a large community clinic that's going to happen this weekend at Metro Park in connection with St. V's. That's going to be, of course, for those people that fall into that phase 1B, and healthcare workers are still getting vaccinated. So we're going to hear more details on what that will entail later on this week. He talked a little bit about people staying safe out there in the weather. Somebody asked whether or not they were having any weather-related issues for people trying to get their vaccines or get to their appointments. Obviously, that's something that they are trying to figure out too. But the biggest thing probably as well coming out of this is just an update on the vaccines. The state of Montana is going to get about 20,000 vaccines in the coming weeks. Felton was asked how much are coming to Billings, and that's when he said about 2,600, 2,650 to be exact, more doses that are going to be coming to Yellowstone County. So, of course, there's a big push that he's seeing from the community for people that want to get those vaccines. However, the slots remain limited. So he again is saying patience is hard and prevention continues to be the best quote unquote medicine, I guess you could say, for COVID-19. We're going to have all of the updates that are coming from today's presser with John Felton. We'll have the very updates and the latest, I guess you could say, tonight on our 5:30 news. So we hope that you stick with us. But until then, we'll see you online.